Hello everyone watching us. My name is Pedson Auds and I welcome you aboard on this program where we are going to talk about a variety of issues, basically healthy issues. And with me I have two guests, and so they will have to begin with introducing themselves as we proceed. Thank you. We are beginning with Mr. Him.
Thank you so much, Pedson and the audience. My name is Salimana Davis, DNK. I am the Guild Minister of Health, Mountains of the Moon University.
Okay, thank you. Mr. Him.
Thank you very much, Mr. Pedson Auds. My name is MMU Owen and I'm the Guild President, Mountains of the Moon University.
Okay, thank you. As I earlier told you that we are going to discuss about health issues. Of recent, we had an information that Fort Portal Tourism City is one of the leading communities or cities or districts that are actually having high prevalence of HIV. So I would like to know, and of course Mountains of the Moon University is located in this particular mentioned city. So as the Guild Health Minister, as you've introduced yourself, what have you done to ensure that you curb this prevalence?
Thank you so much, Pedson, for that good question. At Mountains of the Moon University, we have various stakeholders that ensure that the health standards of the students and the staff are in good condition. Firstly, as the Guild Minister of Health, or as the Minister of Health, as a university, we have the university clinic, which is fully equipped. We have the senior nursing officer, and we have the other accompanying nurse. We have the university counselor. All of these are to spread the rightful information of HIV prevention. You know, HIV can better be prevented than cured. It cannot be cured. So, as the university, we have embarked on preventive messages to our students. But secondly, for these students or some people who already have HIV, we tell them to go test. Number one, you have to know your HIV status, and after knowing it, you don't stop from there. There is something you have to do, and that is getting the medications, and then you follow the prompt guidelines that they tell you. But also, there are these students whom we tell about the preventive measures. We tell them about abstinence, but you know, as the adolescents or as mature men and women, there are some people who say they cannot abstain. Alright, that is not the end of it. Or they can also use other methods, like we tell them, if you have one partner and you are sure of his or her health status, you can only be sure when you go to the hospital or the health facility, which we have at the university, and they test you. So when they test you and you know that you are all negative, then you resort to being faithful to each other. You know you have one partner and that is the only person you are going to be with in sexual matters. And then so another thing is, if at all you are going somewhere you are not trusting, you can decide to go with a condom. We are very glad that we are given lots of condoms from the Uganda AIDS Commission, and we have them as the Guild. We have them as the university clinic. We supply in various hostels or students. We have displayed some condom dispensers in private places, that is in the washroom corners, and students can go there and access and at least be protective. Then also we have what we call post-exposure prophylaxis. If one of our students is raped or has involved himself or herself accidentally in an unprotected sex, we always tell them to report immediately to the university clinic administrators, so that we help them on how to acquire the post-exposure prophylaxis. But this is a drug that you can take after being exposed that will stop or kill the virus immediately. And it can only work, or it is effective, if you take it within 72 hours after exposure. We also have the pre-exposure prophylaxis, which for it is a drug that you can take within 3 days before being exposed. That's when it can work, but the best thing still remains abstinence. Yes, thank you so much.
Thank you so much. Oh, thank you so much. If I can turn to His Excellency Mukonyezi Owen, what have you done? What has your office done to assure students are safe?
Thank you very much, Mr. Pedson Auds. Number one, I will actually look at the new students that we have received of recent, the freshers. Before these students came in, that is why I'm appreciating Uganda AIDS Commission. We had them here working with the Ministry of Health, activating the campaign of fighting against HIV. Even when the freshers reported, we have the services of guidance and counseling, and of course we had the HIV testing campaign here, where anyone would go and be tested for free. And some of them maybe who are not ready to be tested were even given the test kits to go and test themselves. So you can see, even now, even if someone wants to know his or her status at Mountains of the Moon University, you just visit the university clinic and you know your status. Then the issue of Fort Portrait Tourism City being the first, though for now I've never believed that it is the first, because they do not have any evidence to show that it is the first. We are getting people from different places coming in Fort Portrait hospitals to test themselves. We are getting tourists, we are getting people from Kamwenge, Munyanga and other districts. They come and test from here. And of course all the tests and the results they get, they say they are from.
But then when you go to Rome, you are a Roman.
Okay, but now if I go on the percentage that they really gave to our city, when we got those news, I went to the offices of Uganda AIDS Commission. And the reason why I went there is because of the students of Mountains of the Moon University. And we have partnered with them in on different occasions, even at the Freshers Bash. I remember bringing some reading materials for the students. And of course we had a very specific message from Uganda AIDS Commission, and they were talking about the use of drugs, whereby they were discouraging the youth from using drugs, because most of them be exposed to the HIV stuff, the sex and what, unprotected sex, because of the influence of drugs. We have also got, I think, 4 boxes of condoms from Uganda AIDS Commission, and that is all the support to fight against the high spread of the high rate of HIV, especially in our students of Mountains of the Moon University. So we have done a lot to ensure that our students are safe and they have protected themselves from HIV. But the biggest thing I will tell them is to abstain. And if they cannot abstain, let them know the status of each other before they go into acts that may expose them to HIV. And if they are not patient, let them get the condoms and use them.
Okay, thank you. This question is yours. After sensitizing people, how do you get feedback? Or how do you know that the information you delivered is effective?
Oh yes, the best way to get the information or the feedback, number one is that maybe if we normally have health camps that are held actually every semester, and these health camps are to help us because whenever we have them, we have massive HIV testing. So if you have an HIV testing and you find that the rate of infection is lower than maybe last year, then you can know that it means that our students followed the guidelines we told them. But if you find that there is a surge or an increase, then it means that the students are not following the protocols. Because it is one thing to tell the students and they appreciate and they say they are going to follow, but it's another thing when the results turn out to be positive.
You know, we always say that a university is the apex of education. And sometimes when a student tests positive, he or she may become desperate. How do you handle this?
Before testing HIV or AIDS, you cannot just test. You have to first guide someone. You have to first give them counseling. And you tell them you are going to test for your HIV AIDS, but two results must emerge. You will either be negative or positive. You tell them, if we find you are negative, this is what you should follow. If we find you are positive, this is what you should do follow. Because everyone that is tested positive, we normally tell them it is not the end of life. Okay. We give them hope. There is hope for life, there is hope for the future.
So as we conclude, what information do you have for the MMU community and the people watching us?
Thank you so much. In conclusion, I want the MMU students or the audience out there to get to know that HIV has no cure. It is better to prevent HIV than to cure it. Yes.
Your Excellency?
Thank you very much, Pedson, Auds. I think I've told this same information to like 3 groups, that the problem is most of the people just exist. They do not live. And of course we have to live well the moment we all begin living, not just existing. And the day when we stop just existing is the day when we are going to learn about our life. And it's the day when we shall know that life has no spare. When you die, you have died. We have different measures that are put in place. I request especially the students of Mountains of the Moon University and all the people for Porto City at large to use these methods. I know people are old, they have a lot of feelings, they have this, but we have different measures that they can take. They do whatever they are doing and they remain safe, not with HIV. So what I'm requesting, especially students of Mountains of the Moon University, let us protect ourselves from this deadly disease. Some people say it doesn't kill, it kills. And I'm actually emphasizing that it kills. People have left. You find a girl saying for me to go home when I'm pregnant, at least I go when I'm having HIV because it is not visible. I get it. So they are putting into these people the mentality that pregnancy is actually bad,
More dangerous.
actually more dangerous than HIV. But to tell you the truth, HIV is very dangerous and it kills. Then the people who are living with it, let them follow the guidelines given to the doctors, taking the medications, and making sure that they protect the people they are living with. Thank you so much.
Thank you so much for honoring our invitation, and this marks the end of our discussion. I've been having DNK, that is none other than Davis Kwenzera Selemana, who is the Health Minister MMU, and His Excellency Mukonyezi Owen, the Guild President MMU.